Hey guys, Michelle here with Baby Cubby, and we have Dr. Aaron McCoy here from Utah Valley Pediatrics. We're going to be doing a Q&A live stream today on SIDS prevention. We're so excited to have him here. Do you want to tell us a little bit about your background and what you do?
Yeah, sure. Thank you. Excuse me. I'm a general pediatrician here in Provo, and I did my undergraduate work at BYU, and then did my medical schooling at the University of Virginia in Charlottesville, and then my pediatrics training up at Primary Children's, and been practicing general pediatrics in Provo here for about 3 years now.
And he's fantastic. I'm a little bit biased because he's my pediatrician, so I'm really glad that he's here today. But we're so excited to have this. If you guys have questions throughout, we're going to be going over general information and some frequently asked questions, but feel free to type them in. We have Carrie on Instagram and Kelsey on Facebook, and they will be letting us know when you guys have questions. And then this will also be up on YouTube in the next couple days, so feel free to watch our YouTube channel if you have anything that you want to review, or make sure you're sharing it on Facebook so with your friends who might have questions as well. We'd love to get them all answered. So if you guys were watching our Instagram feed, we did have a call out for some questions in preparation for this, so we'll be answering those first before we go into our general information. So the first one was about the Docketot specifically, and just if it's safe to sleep in.
Great question. So rarely do we have evidence on one product in particular, and so I think it's probably better to just talk about general principles. And in looking at some of these sleep positioners, first of all, we don't have any evidence whether sleep positioners are good for preventing SIDS or not. But we do have some general principles that we know do help prevent SIDS, and that would be helping a baby sleep flat on their back and then not having soft pillow-like things around the face of the baby. And so, you know, I rarely like to comment on individual products in particular. I just don't think it's a wise thing to do. I think it's better to just talk to parents about principles. So we know that babies are safest sleeping when they're flat on their back and without kind of soft, pillowy, fluffy things around their face. We know that those things can increase their risk of SIDS.
Okay, good to know. And then another one was if a fan can prevent SIDS.
Yeah, so this one, there's a little bit of mixed data on. Historically, we would say that fans, we don't have evidence either way. There may be some mounting evidence that fans do help prevent SIDS, and I don't think there's any magic to that. I think probably the principle that's at play there is helping babies be not overheated. And so, especially in hot, humid areas, I could see that being more important. Here in Utah, I think it's probably a little less important, but the data seems to be kind of evolving on that.
We have a question that came in. When is it safe for babies to sleep on their tummies?
Yeah, good question. So really two stages. One would be if a baby rolls over on their own. So if you put the baby on the back and they roll over onto their stomach, we don't recommend turning them back over. We know that once babies can roll over onto their own, or roll over on their own onto their stomach, that doesn't significantly increase the risk of SIDS. And then as far as you putting the baby on their stomach, that's probably safe after a year. We know that the risk of SIDS just significantly declines after about a year.
So with that too, I know for me, I know you've told me that before because my babies both rolled over, but I always got nervous if they couldn't roll back.
Yeah.
So if they can only roll to their stomach, is there any increased risk if they can't roll to their back yet?
No significant increased risk. The thing that you would want to do is once your baby starts rolling over, they can really roll into whatever position they want to roll into for sleep, and you can just leave them there. However, we do recommend backing off on swaddling at that point. For the point that you just brought up, are they going to roll over and get kind of stuck in a position that they don't like to be in because of the swaddle? So as soon as they start rolling over, just unswaddle them and let them roll into whatever position they want to roll into.
And just to clarify with the swaddling, we're saying like swaddling our arms, right?
Yeah.
So like a wearable blanket is still okay where their arms are free?
Yeah, so that a wearable blanket would even be preferable to a loose blanket. That would be likely safer than a looser blanket. Yep.
Okay, cool. Also, I forgot to mention, guys, Dr. McCoy is on call, because he's awesome. So he may have to run out before we're done with our live stream, but just be aware of that. So we're sorry if that happens, but he has other babies to take care of. So, great. Are there any other questions right now? Okay. Well, we just want to cover then, like, just some general causes with SIDS. I feel like SIDS is something that, like, as a new parent, you hear a lot. It's, like, scary, but you don't really know what it is. You just know you're supposed to follow safe sleep guidelines. So do you mind going over kind of, like, what the research has said, like, what it is, what happens?
Yeah, good question. So the reason you seem a little confused about the cause of SIDS is even as a medical community, we don't know what causes it by definition. So there's kind of an overarching category of sudden unexplained infant death, and then SIDS would be kind of a subcategory of that. And by definition, SIDS is a sudden infant death that we do not know the cause even after an investigation, after an autopsy, after a medical evaluation. We still don't know the cause. So SIDS isn't only a mystery to parents; it's a mystery to the medical community. And I know that that's a question a lot of parents have. Well, these things that we're talking about, do we have evidence that they directly are causative in decreasing SIDS, or is it more of just an association? And it has to be only an association. Because we don't know the cause of SIDS, it's really impossible to do kind of causative studies, what actually causes it and what can be causative in decreasing the risk. These are just kind of population studies saying, well, we notice that when kids do X, Y, or Z, it increases or decreases their the frequency that we see SIDS, but we don't know the cause.
Okay, and just to clarify too, with SIDS, is it that babies, because a lot of the prevention methods have to do with, like, children breathing correctly.
Yeah.
So is it that babies stop breathing and that's why they pass away?
Yeah, good question, and that's likely the cause of SIDS. But once again, we can't say that for sure that is. A lot of times on autopsy, when kids have suffocated, you can see evidence of that on autopsy. Just a pathologist can look for certain signs to say this looks like it was suffocation. And so when that's the cause, we actually don't call it SIDS anymore. We say that this was a suffocation episode. But if it looks like a suffocation episode, but on autopsy there's just no evidence of that, then it would kind of bump back into this category of SIDS. But all of the thinking and kind of prevention methods are really focused on the baby being able to sleep well. Sorry, Elise.
You're good. Okay, perfect.
We have another question. When is the risk highest for SIDS? When do most cases occur? The first 4 months, first year?
Yeah, good question. So the first 4 months would be the highest risk category there, but we do know that kids are at increased risk up to a year. So all the safe sleep positioning and things like that we're talking about today, they'd be recommended to try and do for about a year.
Perfect. With that then, like, I know the new guidelines that the AAP came out with a couple years, was it last year? Yeah. They came out with, like, new guidelines for where you should sleep with baby and what positions you should put them in. Can you kind of go over those?
Yeah, so the overarching principles there are really just a reinforcement and a clarification of things that were recommended in the past as well. We know that babies are safest to sleep on their back, to sleep alone, and to sleep without loose, fluffy, pillowy things around them. So really the overarching principle is the more boring a sleep environment your baby has, the better. Yep.
When is it safe for babies to sleep in their own room?
Yeah, so as you may have seen a little bit of controversy around this, and that's because the recommendations were a little bit unclear. So they recommended that babies sleep in their own room. Babies are safe to sleep in their own room, possibly starting at 6 months, but definitely by a year. I think that some overarching principles there would be, one, babies still have a little bit of risk of SIDS between 6 months and a year. So probably are a little safer in your room at that time, so you could potentially hear an episode of difficulty breathing. Really, and then the other thing would be under 6 months, babies are still likely to have some nighttime hunger. So you're going to be, getting up and going to their room to feed them as well anyway. So for us, what am I going to do with my own child? Probably somewhere between 6 months and a year, we're going to try putting our own child in their own room. I think a year is very, very conservative. So if you want to be the safest possible, I would go for a year. If you're balancing wear and tear on you with your baby waking up and kind of waking you up at night, and you're wanting to sleep train, and you want to start that between 6 months and a year, I think that would be just fine to do. And it's the recommendations were muddy, and a lot of people kind of were confused on that. Yep.
What does Dr. McCoy think of devices like the Owlet? Do they really work?
Yeah, good question. So we don't have any evidence at all that those decrease SIDS. Excuse me. And so with those home heart and breathing monitors, I think some of the principles there would be, one, we don't have any evidence that they prevent SIDS. If we did have strong evidence that they prevented SIDS, and there was one that was a reasonable price range, we'd probably send all babies home with from the hospital with those, but we don't have any evidence that they decrease SIDS. The other concern that we have with them is that just kind of wear and tear on parents. If any of you have had a friend or family member in the hospital and you've been in the hospital with them, you probably hear alarms going off from a room, there's a heart monitor going off or a breathing monitor going off. Nobody's running. Nobody's afraid when they hear that alarm going off. Why? Because most often those alarms go off because the leads aren't connecting well. So the alarm or the monitor isn't picking things up well, and so the nurses have a way of evaluating that. They can look at their monitor and tell, is this going off because this patient really isn't breathing well, or because the heart rate really isn't safe, or is this going off because the lead isn't connected well? 99 out of 100, it's because the lead isn't connected well, and the nurse can just look at that and say, oh, we'll just give that a minute and see if the alarm will stop. And it does. You don't have that luxury at home. So your alarm goes off because the leads aren't connected well with one of these heart monitors. You wake up in the middle of the night terrified your baby isn't breathing or their heart rate is low, and then you walk over there and your baby's just fine. And so my main concern with these is that, one, we have no evidence they do any good for parents, and two, I think it's 99 out of 100 times more likely to be a false alarm that's waking you up and causing you stress at night than you actually catching that episodes of SIDS. So I don't recommend those for parents. And when I have babies come home from the hospital that they actually needed an alarm in the hospital and they need it at home for various reasons, I try and get babies off of that as soon as we can for those reasons.
When can children start using pillows?
Yeah, good question. So once again, I would say about a year. About a year, we know that the risk of SIDS goes down, and I think that's a good time to start introducing pillows. Yep.
How can we deal with a screaming baby who has a bad startle reflex due to sleeping in their own bed on their back?
So a baby that has a bad startle reflex and they wake themselves up screaming on their back. Well, if they're not rolling over yet, I would feel just fine swaddling their arms in there. If they are rolling over, that's a little tougher. And this is where sometimes I have conversations with parents about, okay, well, what is ideal, and then what is realistic. And I think that these kind of SIDS prevention sleep recommendations come into that discussion. So what is ideal? If the baby's above 6 months, it's ideal to not have the baby's arms swaddled. We want the baby to be able to roll freely and not get themselves into a compromising position. However, if you and dad or you and mom are waking up 5 times, 7 times, 10 times a night with a screaming baby that startles themselves, I would probably balance out that risk and say, well, I may slightly increase my kid's risk of SIDS by swaddling their arms, but I know I'm significantly increasing our risk of putting this child up for adoption if they don't get some sleep. And so, I think you kind of have to balance those two things. Yeah.
With that too, then there are like this swaddle blanket. They create one that has like an arm that's free, but then the other arm is still in. Would that be a more ideal thing than doing a regular swaddle, or would?
Yeah, good question.
Just questions for.
And we so once again, we don't have good evidence on individual products and individual characteristics of products. I mean, really the two things that you want to look at with sleep sacks or sleep blankets or those sorts of things. One, would be under age 4 to 6 months or not rolling over yet. It's okay to have their arms swaddled. Once they're rolling, you want their arms free, and so that would be the principle there. The second thing would be you don't want something that's too tight on their hips. We also worry about swaddling blankets or swaddling sacks and things. If they're a little too tight on their hips, we worry about hip development. So you want their legs to be kind of nice and free, and I think those would be the two characteristics to look for.
Okay. Do you have any other ones? Okay. So I know too, like co-sleeping was a big thing with the new guidelines that like the AAP actually recognized, but again, like you were saying, there's ideal and realistic. So if you wouldn't mind going over like those co-sleeping guidelines and like what, I know there's multiple types of co-sleeping as well. So I think that would be
good question. So with co-sleeping, we know that babies are safest sleeping alone. We don't have a lot of good evidence on co-sleeping devices, so things that connect to your bed or things that are in your bed. We just don't have evidence either way on those. And so once again, I would just kind of look at principles. Is my baby flat on their back? Am I worried that there's something they could roll into and have a hard time breathing? Is there kind of fluffy, pillowy things that they could move their face into and have a hard time breathing? And if not, then those are likely safe. As far as unintentional co-sleeping, so this would be your breast or bottle feeding your baby and you fall asleep while you're feeding your baby, which we have all done. You are more safe to be unintentionally falling asleep while feeding your baby in bed than you would be in a couch or an armchair. So probably a little better scenario that if you are going to be intentionally or unintentionally co-sleeping, to have something that attaches to the bed that if you fell asleep and the baby was just kind of right there, they'd probably be safer than if you got up and walked out to a rocking chair or the couch or something like that. Yep.
I'm sure you've already answered this, but at what age does the risk of having a baby pass away from SIDS decrease?
Yeah, so at a year there's a pretty steep drop off. Yeah, so your first 4 months are especially critical, and then beyond 4 months we know that there is still some risk up to a year, and then beyond a year the risk is pretty small.
Okay, sorry. Just going through these. Oh, we did have some questions about like pacifiers and why those help.
Yeah, good question.
Big recommendation to give your baby a pacifier.
Yeah, and we do know that pacifiers decrease the risk of SIDS. We don't know why. Interestingly enough, if a baby falls asleep with a pacifier and then 2 minutes later the pacifier falls out, it still decreases their risk of SIDS during that sleeping period. I don't have a good explanation for you. A lot of the theories are it's just a little bit of stimulation, just kind of keeping their brain just a little bit stimulated to be in the sucking motion, and so they're less likely to have an episode where they stop breathing. Any sort of stimulation to you, pain or really any sort of nervous stimulation is also a stimulation to breathe. So that's probably involved in some way, but honestly, we don't know.
Just know it works.
Yep. Yeah.
Then I know too, like the recommendation, they say a lot, like not to give your baby a pacifier within the first month while you're learning to breastfeed. Is that really? I've also heard from nurses, like in the hospital, oh, babies can use everything. Like there's no such thing as nipple confusion.
Yeah.
Babies just have a preference. So what would be like?
Yeah, good question. So the official recommendation on that would be to wait until your baby has established good feeding. Probably a week or two, and then introducing a pacifier and then getting the benefits of SIDS reduction from that. What I will tell parents who ask me about this is nipple confusion real? Probably for some babies. I will tell them though, if you are going to be going back to work in 4 to 6 months or whatever the case may be, and you know that you're going to have a baby that needs to breastfeed and bottle feed, I would start introducing a bottle relatively early, somewhere in that 2 to 4 week window or shortly thereafterwards, because 10 to 1, I see babies that will breastfeed that will not take a bottle than the other way. That there's a breastfeeding baby and then you introduce a bottle and all of a sudden they don't want the breast anymore. That's very rare. I may come across that once a year or less. just about every week I'm talking with moms that want to go back to work and they're breastfeeding their baby and their baby just flat out refuses a bottle. And so if you plan on having both options available for work or for convenience or whatever, as soon as your baby is established feeding, I would go ahead and start introducing a bottle slowly. You'll be grateful you did later on. Yep.
And you can pass them off to the husband.
Yep, exactly.
Your turn.
Get some help. Yep, exactly.
Then you can take a break. Cool. So with the binkies too, I'm sure, again, this is like a question about a specific product, and I know we're not saying about specific products, but I assume this will be a question for some parents, or I know some parents do this with wubba nubs, where they're the little animal connected to the binky.
Yeah.
I'm assuming that's not okay to let them sleep with overnight, correct?
Yeah, I think,
Just with those principles?
once again, it would be something soft, pillowy that could be in their face. And, even beyond that, the recommendation is to not have anything with kind of a cord-like structure to the binky.
Even like a pacifier clip.
Exactly, a pacifier clip, because that could get wrapped around the throat. So you're better off with, at night, just the little boring, isolated binky.
Again, as boring as possible.
Yep, boring is the name of the game with sleep for babies.
Babies don't need anything. With that too, then I know, with boring, like in Finland, like cardboard boxes are a thing. Is that okay for parents to even use? I know that's kind of been like a new thing, a trendy thing that some parents have been doing.
Yeah, good question. And I haven't seen any evidence on those here in the United States. My my concern with them would be having a wall, like a wall-like structure that the baby could roll into. I know that in a lot of countries, the emphasis behind this was to try and decrease co-sleeping. That figuring, well, a baby is probably safer sleeping in this flat, boring cardboard box than sleeping with mom and dad in the bed. So that was kind of the push there, was to give a safer option. But I think, here in the United States, we've had so much emphasis on SIDS prevention for the last few decades. I think you have a better option. I think you have a lot of better options with your bassinets and things.
Good to know.
I have another question. I didn't co-sleep with my baby, but I would take naps with her on the couch because she always had to be held. Is that something I should avoid with my next baby?
Yeah, good question. Once again, it's getting back to ideal versus realistic, right? And so ideal would be all the safe sleeping techniques that we talked about. However, it's like just being honest. Have I ever slept holding my baby? Yes, I have. And it's like I understand these principles, but sometimes there's ideal and then there's realistic.
You gotta survive as a parent.
Yeah, sometimes there's just survival. So I think I wouldn't feel guilt with these things, right? I mean, especially for the first few weeks, you're just trying to survive, and then babies are just pretty demanding for the first few months. So I think if you're recognizing all these principles we're talking about, you're making a good effort to do them, but you happen to take a nap in a armchair with your baby. Well, you and everybody else, and so that's okay. I think if 9 out of 10 times, 99 out of 100 times you're doing this safe sleep techniques, you're doing a great job.
And I think that's a good way to put it. Like, basically get educated, do all you can to know what the principles are, but then sometimes babies just need something else. Yes. They have opinions of their own. Yeah. They're so small, but there's so many opinions. I just don't know. Cool. And then I know, let's see. So I know, for me, my first spit up a ton. I was really worried about her spitting up and not being able to breathe. And so, what would you recommend but you still need to put them on their back. That's the safe guideline. So for a baby who is spitting up or has a lot of reflex, I know that's a question we get a lot too.
Yeah, good question. So I think the thing that's most helpful to understand there is that your baby has protective reflexes. So in the throat, if reflux starts to go down the breathing tube rather than the swallowing tube, your baby has a reflex to close that tube off and cough and sputter until it's out of the way. You've seen your baby do this. You start feeding your baby and either a fast letdown with breastfeeding or it just came out of the bottle a little quicker than they intended. They hold their breath for a second or two and cough and sputter and then get it out. And then they're like, hey, now I'm ready to feed again. So that's a protective reflex, and the same thing happens with reflux at night. So if your baby refluxes and some of that reflux tries to go down the breathing tube, it's going to close off, cough and sputter, protect themselves. In a normal, neurologically healthy baby, There are some exceptions, and if there are exceptions, you would be told about those exceptions for your baby. They're rare. So without those unusual exceptions, your baby is far safer on their back, even with bad reflux, than they would be in a different sleeping position. Babies they protect themselves, and you don't need to worry about that.
Same thing, but with stuffy nose on their back.
Yeah, yep. So same thing. So once again, I would trust your baby reflexes to protect themselves with mucus draining down the back of their throat, and then to just help them breathe better. You're safer doing a humidifier and sucking out the nose than you would be changing the sleep position. In fact, I would probably be a little more worried about putting my baby in a different sleep position when they're sick, because I already know that their breathing is compromised, and now I'm putting them in an even more compromising position. So I would stay with the same recommendations and treat the cold instead. Yep.
Good way to go. I know too, like we've heard before, like crib bumpers are a risk for SIDS, but then I've seen like perforated ones around. Are those like any safer, or are they still not recommended?
Yeah, good question. So I think the principle here would be your baby is not going to roll themselves hard enough into the edge of the crib to hurt themselves. So I don't think that the bumpers are doing you any good, and they're adding some risk, even if they're perforated. I just don't see any benefit there. Where we do sometimes talk about putting things outside the crib is worry that the baby is going to put their arm through and kind of get stuck, or put their leg through and going to get stuck. And if that's the case, what I usually recommend to parents is put kind of a mesh material on the outside of the crib, and that's just to prevent them from putting a limb through. But I'd be very hesitant on putting things inside. I just don't think it's going to do any good. Your baby's not going to suddenly super roll into the side of the crib and give themselves a concussion or something. Just not doing any good, and potentially could be a risk.
And then another two, I know this might not be a recommendation anymore, but when I had my first, I know like having them sleep in a car seat was a risk. Mm-hmm. Can we talk a little bit about like why that's a risk? And like, I know like as a first time parent, I was even worried about taking long trips without being able to watch her.
Yeah.
So
good question. So, and this is a risk mostly under age 4 months, because babies don't have good enough neck control, head control to be able to stay in a safe sleeping position. So when babies are sleeping vertical or somewhat vertical like that, they have a tendency to put their chin down into their chest, and that's a position that can compromise breathing. So I think in these situations, if your kid fell asleep in the car and you're going to take your kid into the house, if you're going to be, in the living room or the kitchen doing something, and your kid is sitting right next to you, I wouldn't feel the need to wake them up, get them out of the car seat, and go put them in the bed. What I wouldn't do is you get home late at night and your baby fell asleep in the car, and you're like, look, we're going to bed, but we're just putting the car seat here next to the bed, and I expect my baby to sleep for the duration of the night like that. I think that would be unsafe. In a position where you're able to supervise the baby, see that they're breathing well, you're right there with them, I think you'd probably be just fine letting your baby take a nap supervised. But especially under 4 months, we know that their neck can be in a compromised situation that way.
Well, let's talk about a little bit about like maybe the different types of co-sleeping. I know just because that is since the new recommendation is to have them room sharing, and how that's a different type of co-sleeping versus like bed sharing.
Yeah, exactly. So with regards to room sharing, we kind of talked about that. We know that they're probably best in your room for at least 6 months, possibly up to a year, but that's 6 months to a year is a little bit of a gray zone. Just do what works best for you, balancing, well, probably a slightly decreased risk of SIDS in my room versus I need to sleep and they need to sleep train, so they need to be on their own, kind of balancing those two things. With regards to sleeping with you, we don't have good evidence on individual products. That's kind of a theme. We don't have good evidence on individual products. And so, is the one that attaches to the bed safer than the one that's in the bed, or those kind of things? We don't know. So I would kind of stick, if you do want to kind of share a sleeping space, Once again, just make sure that you're going by the same principles. Are they flat on their back? Are they surrounded by fluffy, pillowy things? Am I worried I'm going to roll onto them or into them? And if not, you're probably just fine with whatever you have. Yep.
And are there any other big associations that people should be aware of when it comes to SIDS?
Yeah, I think one that we haven't talked about is smoking. So whether no matter who smokes in the house, but especially if you as the parent smoke in the room or smoke with the baby, we know that also increases their risk of SIDS pretty significantly. So we want you to be healthy as well, to get rid of smoking. But that's also for not only for SIDS, but for a million different reasons. That's going to be a huge benefit for your baby. Second one is actually doing the immunization schedule. And once again, these are associations that are sometimes difficult to explain, and I can't pretend to explain that to you. But we know that babies who keep up on their immunizations actually have a decreased risk of SIDS as well. We can't explain that. I don't know.
We just know it happens.
Yeah,
Two, I know in the past it's been said that breastfeeding versus formula feeding, breastfeeding will prevent SIDS. So if you're I formula fed with my first, and obviously she was fine, but do we know anything about why that happens, or should parents be super worried? I don't know.
Good question. So I haven't read anything about why that is the case. But and once again, there's ideal versus realistic, and with our child at home, we were able to breastfeed for a while, but then we had to switch over to formula, and that wasn't so much we weren't weighing SIDS into that. It was just that was that was real for us. That's just what happened. And so if you can breastfeed for SIDS and for a million other reasons, awesome. If your baby needs to formula feed like ours does at home now, then that's what it is. Okay.
Kind of going along with that, is it bad for the baby to fall asleep while drinking a bottle?
Yeah, good question. No, your baby's still going to have those protective. So I guess good question. If you're feeding them and they fall asleep, no. Your baby's not going to choke on the last few drops or whatever, and you can just take the bottle away. Sleeping with the bottle by themselves, yes. Yeah, so we would want to avoid that. But if you're feeding them and they fall asleep, they'll be able to protect themselves, and you can just pull the bottle away or pull your breast away when they fall asleep. Yeah, and that's not risky in any way.
Awesome. I know, you have a minute?
Just not
Oh, okay, sorry. 5-minute warning. I know, too, one of my favorite things you ever said to me was, no one who formula fed didn't go to Harvard, so.
Yeah.
I don't know. So just for all you moms out there, just know that is best. It's the best way to go for SIDS and whatever else. Cool. Well, is there anything else that, please ask your questions while we just only have a few minutes, but is there anything else that you feel parents really need to know or is important for them to be aware of when it comes to their kids?
Yeah, I think we mentioned it a few times, but I see a lot of parents who worry and feel guilty about little minor things that we're talking about here. Their baby did this one time or something like that, and I think most moms need to just realize they're doing a fantastic job. And the fact that you're even worried about this and asking questions and trying to find the right thing to do shows you that you're doing a fantastic job. So give yourself some credit and don't worry about the one time your baby fell asleep on their belly or something like that. You're doing a great job.
And then, I remembered my question from a while ago. I know firmness of mattresses is a big deal. Obviously, with infant mattresses, there's a difference between there are differences in firmness.
Yes.
What counts as a firm sleep surface?
Yeah, so a firm sleep surface is one that your baby doesn't sink into. So it can still be comfortable. We just don't want to see that your baby sinks down. And so if you put them on and they just stay where you put them, it can be comfortable and a comfortable place to sleep. They don't need to sleep on plywood or something like that. But if they sink in, if you see them sink in, then that would be an unsafe surface.
And is that even a sink in over time, with memory foam, for instance? It's over time?
It is, definitely. Yep.
Okay. Well, guys, that is all the time we have. So we want to thank Dr. McCoy so much for coming out. He's so great. If you guys need an awesome pediatrician and you're in Provo, check him out, UV Pediatrics. As well, just so you know, this will again be on Facebook, so feel free to share it or review it. It will be on Instagram for the next 24 hours, and then we'll have it up on our YouTube page in the next couple days, if not today, depending on our video team. But they're awesome, and so they're video editing ninjas. We also have some information on our blog about lots of the products, if you guys do have questions about products. And we're happy to answer questions for you about those in terms of if they follow those safe sleep principles or not. You can shop those products at babycubby.com as always. We have free shipping. And then also, we will be doing these lives every Friday if you haven't gotten the notice yet. We will be doing a poll here today or in the next couple days to see about the time, because we want to make sure that this time is a good time for all you guys. But yeah, thank you so much again for coming. We're super grateful. And your baby's been walking around, so cute. So we'll see you guys all later. Thanks so much. Okay. Always like, how long did
Good job. There were a lot of comments saying, "Thank you, Dr. McCoy. This was so helpful. This was so helpful."
Oh,
so
good.
like ask questions, but lots of
Good.
good comments about it really helped us. So
Yeah.
great.
Sorry, I ran out of questions after a while. I was like, oh, we already went over all these.
Yeah, no, that was
325
exhaustive.
views.
Yeah.
Wow, that's
They
awesome.
usually have like 100 something.
Yeah, it was really good.
325. Hey, thank you very
No,
much.
thank you so much
It was
for
a pleasure.
coming.